The International Organization for Migration says that it was recently approached by the Embassy of Zimbabwe in South Africa to help facilitate fundraising and provision of key services to the Zimbabweans currently unable to cope with the socioeconomic effects of the ongoing breakdown in South Africa. Now, the Zimbabwean embassy announced yesterday that it's in the process of repatriating hundreds of Zimbabweans back to Zimbabwe with the help of the IOM. For more on the impact of COVID-19 measures on migrants, I'm now joined via Skype by Charles Kwenin, who's the Regional Director for Southern Africa at the International Organization for Migration. Thanks so much indeed for joining us, and welcome to the program, Mr. Kwenin. Okay, let's chat. I suppose in the first instance, what are the major things that you've seen as a result of COVID-19 that have been affecting migrants in particular?
Hello, good evening. This COVID-19 has demonstrated an unprecedented restriction on human mobility of unprecedented scale globally and within the South Africa region. And one of the severe effect that we're witnessing now, it is the cross-border trade. As you well know, for migrants, a lot of them work in the informal sectors. And in Africa, about 70% of women are engaged in cross-border trade. So you can imagine the restrictive measures that have been taken by government by way of addressing the spread of the virus. Suspension of airlines, lockdowns, border closures, and restrictive human mobility. So this has caused unprecedented suffering, especially on migrants who live mostly on the fringes of the society. So, of course, a number of countries in the Southern Africa region have taken restrictive measures. And that has had a severe impact on migrants who are very vulnerable, and they need to be included in every approach by government.
Are there some countries that are faring better than others in dealing with this mobility challenge that you've described?
Well, I think it's difficult to say at this point in time because, as I mentioned earlier, most of the countries have taken emergency measures, and the Southern Africa region has been one of the regions that has taken very robust, very comprehensive approaches in restricting mobility, because we all know that this virus does not know borders, it does not need visas, so it's very difficult at this point in time to compare countries which are doing well or not doing well, but perhaps after the virus, if we're able to deal with it, that is where we will see how governments manage this process, especially how they recover from the socioeconomic impact of this virus, and how migrants are able to find their way, to integrate in the society, because a lot of them are sending money back home to support their families. So it will be very difficult to see what innovative ways, what kind of approaches or imaginative or creative way that they can adopt. And otherwise, comparing countries who are doing well or not doing well at this point in time, I think it's something that will be very difficult, because it will depend on capacity, it will depend on how they're able to manage the whole virus and bringing economies back to scale.
What do you think that authorities can do? A lot of relief packages that countries are involved in trying to deal with their own citizens, and they don't have money, many of them, to now spend on nationals from other countries, many of which are undocumented. But these people can't be left to fend for themselves, otherwise they will starve. What can authorities do?
Well, as the UN Secretary General did mention in his report, this is the time for burden sharing and shared responsibility and global solidarity. So I think this is a time when governments have to adopt whole of government and whole of society approaches, where all hands have to be on board. So leaving migrants out will be very detrimental because, as I said, this virus moves from person to person. So it's important that governments adopt a comprehensive approach, including migrants, asylum seekers, and refugees, to be able to deal with it in a holistic and integrative way. So indeed, it's important for governments to include migrants and the vulnerable group in every comprehensive approaches, and very inclusive approaches in dealing with the whole socioeconomic dimension of this virus. You know, a number of governments have adopted, we have solidarity funds distributing food parcels, and I think it will be very important to have migrants, refugees, and asylum seekers included, because if they are excluded, especially from basic social services, this is a virus where we're supposed to adopt, washing hands, hygiene, sanitization. So you can imagine if migrants are left behind, you can imagine the impact. That is more or less a leakage of whatever robust effort government will be making. And that is why it's important that migrants are taken care of. And not only migrants, all the vulnerable people in society, children, women, and everyone should be on board. And government should strive as much as they can, despite the very limited resources. And that is why I think burden sharing, and IOM is working very closely with the government, with the UN agencies, the civil societies, to do whatever we can in the support of government efforts. Yes.
I see that you're working with the Zimbabwean government to try and get as many Zimbabweans who want to return home to be repatriated. But there are nationals from other parts of the continent, in South Africa in particular. Will they be getting assistance to try and get back home?
Yes. You know, IOM is the UN migration agency working with all the member states. So the assistance that IOM is provided, we're working with all the governments, not only the government of Zimbabwe, but all the governments in Africa and globally to assist their migrants. But essentially, in South Africa being the major receiving country, in fact, we are assisting all the migrants. Just before the COVID, we assisted a number of Ethiopians from Zambia back to Ethiopia. And just last week, we assisted a number of Ethiopians, those who survived the container, during which 64 people perished in a container from Mozambique. We're sent to, and tomorrow we'll be working with the embassy of Zimbabwe to assist about 400 migrants who are willing to return. Last week, we had a meeting with all the SADC ambassadors and some of the ambassadors of the major migrant receiving countries. We had a meeting to coordinate our efforts in supporting their, all the very good initiatives that they are taking. So indeed, it's not only Zimbabwe, but we are working with all the government. And we've actually established a task team comprising of ambassadors of Tanzania, Zambia, Lesotho, Zambia, and Zimbabwe in coordinating all these efforts with our sister agencies and optimizing the regional assets of the United Nations to support the efforts of the member states.
All right, and perhaps finally, in the spirit of joint responsibility and working together, do you think that at this time that, migration rules, visas and that kind of thing can be relaxed during this period of time? Because there are people that are undocumented who perhaps won't come forward for assistance for fear of being locked up and so on and so forth, that maybe during this time there could be a relaxation of some of these rules.
Well, I think that would be very difficult, initiative at this point in time, especially in the very short term. Because as I mentioned, this virus does not know borders. It does not need visas. So, relaxing borders at this point in time will be difficult. But the dangerous part of it is the fact that whenever government introduced restrictive measures to prevent people from crossing borders, migrants are very innovative. They will use unauthorized pathways to enter And again, it creates business for human traffickers and smugglers. So it's a very difficult time for many governments. Whilst the restriction and border mobility is very essential at this point in time to curb the spread of the virus, at the same time, it also leads to very restrictive and very difficult moments for migrants who actually remit a lot of money back home. Imagine in 2018, the World Bank estimates about 85 billion in remittances, was sent to Africa. So in a situation like this where migrants are unable to work, most of them have to be out there working in the informal sector. So with the lockdowns where they're unable to work, it's going to create a lot of, difficulties for government, because a lot of them, especially with the porous borders of many African countries, with the weak capacities in immigration and border management regimes, is going to create a lot of unauthorized routes, which will be another challenge for governments in a very short term. But in the medium and long term, I think it's an opportunity for government to also undertake robust measures in their border management regimes to improve the way migration is governed. And it's important to note the objectives of the Global Compact on Migration. And IOM is ready and willing to work with its member states to enhance its capacity and to build the systems, the gaps that have been identified, including migration data management, to be able to provide evidence-based policies to guide the way migration is managed, so that migration is managed in a way that is beneficial. So that because it's inevitable, we cannot stop it. It's desirable and it's beneficial, depending on the way it is managed.
Okay.
And for IOM, we always underline the fact that migration is not a problem to be solved. It's a human reality to be managed, as we've seen in this particular pandemic.
All right, Mr. Kwenin, we're going to have to leave it there. Thanks so much indeed for joining us and highlighting the plight of many migrants across the continent, wherever they may be, and the challenges they're facing, particularly under this COVID-19. That was Charles Kwenin, who's the Regional Director for Southern Africa at the International Organization for Migration.